Hi, this is Dr. Kelley Mulhern from Thrive Wellness Center, and today we're going to be talking about headaches. There's lots of different kinds of headaches, and I would say probably most people in their life have experienced headaches at one point or another. And so today I'm going to take you through the very basics of some of the different types of headaches. A little bit about our office, Thrive Wellness Center. You can see we do a lot of different services here. Thank you for taking the time out of your crazy schedule. I know that people have so many things pulling at them and requiring their time. So thank you for being here with me today and for taking a little bit of time to invest in yourself and learn more about your health. Now, before we begin, if you have questions, please feel free to email them to me after the webinar. The webinar is going to last somewhere between 15 and 20 minutes typically. A little bit about me, Dr. Kelley Mulhern. I have what I call alphabet soup after my name. A few interesting tidbits, I guess. First, I've been a member of the Foundation for Wellness Professionals for quite some time. That is a 501c3 nonprofit organization that is dedicated and committed to helping to educate our communities and people in our communities about health and wellness options. So I do volunteer my time doing talks like this and others throughout my community. By training, I am a doctor of chiropractic and have been in clinical practice now for over 15 years. I also, however, have a master's degree in public health with a concentration in epidemiology. Now, oftentimes I get asked, what does that mean? That means that I spent almost 2 years of postgraduate education focusing on infectious diseases, epidemics, pandemics, viruses, bacteria, all kinds of fun stuff. I am currently enrolled in a postdoctoral certification program in functional medicine, and I have completed a postdoctoral certification in the diagnosis and treatment of accident-related trauma injuries to the head and neck. I'm also a published author, and I am on a mission. I'd like to take just a quick second to share with you my mission is that I want to help as many people as possible live happier, healthier, longer lives with no medication and no surgery when that's possible. And that's why I do things like this, so I can expand that reach out and help as many people as possible. Now let's get right into the good stuff. As I mentioned before, there are many, many types of headaches, so we're just going to touch on briefly kind of the 6 or 7 most common. The first are stress headaches. We've also heard them called tension headaches, muscular headaches. Again, pretty much people can identify with this one. Most people have had a stress headache at one point in their life. The next type of headache is an allergy or sinus headache. Those are, again, common with changes in the season as people are dealing with allergies or sinus infections, upper respiratory issues that can contribute to that as well. Cluster headaches are a very kind of specialized type of headache that typically occur more in men and really typically on one side. High blood pressure headaches occur when people are suffering from hypertension. That can be when they don't know they have high blood pressure. This can be one of the first symptoms they have, or it can be a sign that their medication is not working or is not where it needs to be. Hormonal headaches are perhaps some of the most difficult to deal with and the difficult to treat. And then we have migraine headaches, and there are classic migraines, optical migraines, with and without a prodrome, all different types of migraines. Now, in subsequent webinars, I'll be taking each one of these individually and describing how are they different and how do you know if you have that kind of headache. We'll be talking about what are the locations of each of those headaches and how long do they typically last and what are the common triggers and how do we treat them. So stay tuned for some of those future webinars where we talk about each one individually. Now there is one more type of headache to mention, and that type of headache is a pathological headache. A pathological headache is oftentimes described as the worst headache of somebody's life. Even if they've had headaches before, this one can be way outside the norm for them. And this could be indicative of a serious issue such as stroke, an aneurysm, a brain tumor, something along those lines. So thankfully those are not the most common type, but I would be remiss if I did not mention that type of headache. And if you are experiencing what you would consider to be the worst headache of your life, or one that causes symptoms that you've not experienced before with a headache, or one that lasts an extremely long time, then that would be one that you should seek emergency assistance for. Now, appropriate treatment of a headache is determined by the cause of the headache. And as we've seen, there are several different types of headaches, and they're all going to have different causes and different triggers. And we can take something orally to help reduce our pain. We all need to get through our days. We've got busy lives. But we just have to remember that the cause of the headache is probably not a deficiency of aspirin in your system. It's probably not a deficiency of ibuprofen or Excedrin in your body. So while that can be temporary short-term relief, it is not designed to treat long-term. So again, the appropriate treatment is determined by the cause of the individual headache. And yay, here's the wonderful news, not really. You can have more than one headache at the same time, right? Adding insult to injury. So you could have a sinus headache and then on top of it get a migraine headache, or you could have a stress headache and on top of it get a hormonal headache, etc. So sometimes it can be a little difficult to parse out which is what type of headache and how do we treat. And that's kind of, for more difficult cases, that's why you would work with a physician. So proper diagnosis is absolutely critical to make sure that there's not an underlying issue or problem that needs to be addressed. Now, I mentioned we can always take something orally. So over-the-counter and NSAID options. Now, NSAID stands for non-steroidal anti-inflammatory drug. And those are the ones that you can widely get over the counter. There are several different types, even more brand names, more generics, widely available, but they are not without risk. People oftentimes think, well, it's just ibuprofen, I can take a handful. And over 10,000 people in the United States die every year from proper use of over-the-counter or NSAID use. That means they did not take a handful. They did not take too many in a restricted time frame. They used them as they were supposed to use them, but because of other underlying health issues or other problems, it causes issues in their body and they pass away. So over 10,000 people every year from over-the-counter use. Now, oftentimes, if somebody is taking an over-the-counter medication for a headache and they're doing it once in a blue moon, I don't have a problem with that. But what happens is we get so busy in our lives and we get so accustomed to what we're feeling, it becomes part of our routine. So if you take 4 or 5 ibuprofen a day for 2 days, probably not a big deal. But if you take 4 or 5 ibuprofen a day for 10 years, that's a problem. So definitely showing a need to get that addressed. And so many times when I'm talking to people in practice, they'll say things like, oh, no, doc, I'm great. Nope, I just have my daily headaches. I'm great. I just have my normal migraines. And then I have to let them know that headache pain is not normal. It's a sign that there's a problem. And again, so some of the common names, ibuprofen, naproxen, or naproxen, ketoprofen is a newer one, but they all have their complications. Now, we've all heard about people taking daily aspirin for heart issues, and the jury's actually out on whether that truly helps or not. But a lot of people do it just because they're not sure. But one thing we do know is that taking daily aspirin can increase the risk of brain hemorrhage. So researchers have found that taking daily doses of aspirin can reduce the number of heart attacks by 32%. Again, I've seen some other numbers that are saying, well, we're not quite so sure. But even if we give it the benefit of the doubt, they also found that daily aspirin could increase the risk of a hemorrhagic stroke, which is a bleeding type of stroke, in serious gastrointestinal damage by 84%. So having to weigh the pros and the cons with that for sure. And furthermore, aspirin can cause Reye's syndrome, a rare brain and liver disorder in children, which I think probably by now most people have heard about that. That's been around for quite some time. Now, one thing that I will mention is that this slide refers to gastrointestinal damage. We do know that taking these non-steroidal anti-inflammatories can cause gastrointestinal bleeding, and that is in fact one of the reasons why some people die after taking them. For some people, if they have other underlying issues, it can actually cause a GI hemorrhage or long-term GI bleed. But on average, your GI system will bleed about a tablespoon every time you take an over-the-counter nonsteroidal. Now, Tylenol is another one that people like to talk about. Tylenol is a brand name for acetaminophen, but people who take acetaminophen every day for a year increase their risk of kidney failure by 40%. So a lot of these nonsteroidals are highly toxic to our bodies. So GI bleeding, liver failure, kidney failure. The link between liver damage and acetaminophen was reported over 3 decades ago. So this is nothing new. We've known about it for a long time. Children's Tylenol actually now has a warning label on it because over 100 kids a year die due to liver or kidney failure from taking children's Tylenol. So just kind of a wake-up call. In the grand scheme of the number of children in the United States, 100 isn't very many, but if that was your child, that would not be a consolation. 100 kids for something that's preventable is way too many, in my opinion. Now, a study of over 6,000 people who suffered from recurring headaches that they had suffered with for anywhere between 2 years and 25 years showed that a spinal injury or an issue in their spinal cord or spinal area was the most important factor in the cause of the headache. So again, many headaches are caused by damaged structures in the neck. So this picture, this graphic, shows some x-rays, and on the left-hand side we see normal x-rays. All the way to the right-hand side we see abnormal x-rays and kind of everything in between. It's pointing out differences in the curve. All the way on the left side, we should have a curve that roughly mimics the shape of a banana in our neck, with the apex pointing forward. And so you can see that yellowish green line kind of follows that curve, and that curve looks pretty good. Little degeneration, etc. And then as the spine degenerates, we can see that the curve changes, the bones change. We now have bone spurs. We could have bony fusion. So as that spine changes alignment and deteriorates over time, what I call spinal decay, then that can definitely lead to headaches. Now, for spinogenic headaches, those are headaches that we refer to that are caused by issues in the spine. Chiropractic care can restore proper spinal alignment. That removes the irritation to the delicate spinal nerves, allows for full communication between the brain and the body, which allows proper blood flow to the brain, and it resolves the headache and can provide other health benefits. There was a study that came out roughly a year ago now that showed that for people that did not have the proper curve in the neck, like we were looking at the previous slide, blood flow to the brain can be reduced by as much as 30%. So again, for people with headaches and having kind of that daily brain fog, it makes total sense because the blood flow may not be getting to the brain the way that it should. Now, for those of you unfamiliar with chiropractic care, most people think about chiropractors when they have neck pain or back pain, even headaches, and we're great at helping people with those things. But that's really the tip of the iceberg. Only 10% of your nervous system carries pain. The rest has to do with function. That is why there are other health benefits that I referenced at the bottom of the slide. So a simple way to think about this is we know that the brain and the spine and the nervous system run the body. They control everything we think about, everything we don't think about, every action, every function in our body is controlled by our nervous system. Now, the nerves come down our spinal cord and then branch out through holes in the side of the spinal column, and then those nerves branch and branch and branch and eventually reach every cell in the body. I don't know who counted because it was not me, but they estimate between 50 and 70 trillion cells in the body, which is a 50 or a 70 followed by 12 zeros. And those cells have to be told every second of every day what to do, what not to do, how to do it, when to do it, etc. And those messages are flying back and forth at about 300 miles an hour. So that's a lot going on. Now, needless to say, things can interrupt that communication. One of the biggest things that can irritate or interfere with that flow of information is a very small misalignment in the spine, what we call a vertebral subluxation or a misalignment. What that does is it irritates those delicate nerves, causing dysfunction wherever that nerve goes to within 3 days. So you have a spinal misalignment, you can have end organ dysfunction in as little as 3 days. And the challenge with that is that we don't usually feel it because only 10% of our nerves carry pain. So imagine maybe you were you had some kind of an injury or an illness or something that caused a misalignment in your spine, I tell people you can think of it like static on the phone. So now the brain can't really communicate with the body so well, and now things start to decline or deteriorate, but you might not feel it. And if we've had those misalignments, they could be there for a month, a year, 10 years, 20 years, causing damage and destruction. It's kind of like decay in a tooth where you don't feel it until it's been there long enough to create a big hole in your tooth, and then it's a problem and needs to be immediately addressed. Now, oftentimes one of the biggest traumas we have to our spine is being born. And it doesn't matter if that's a vaginal delivery or if it is a C-section. Either way, it has different traumas to the spine. And that's why a lot of chiropractors see children. And of course, you adjust them very differently than you adjust an adult. And they respond fantastically to chiropractic care. And one thing I will mention also about kids is 15, 20 years ago, we were told a child with headaches is so abnormal, we have to rule out cancer. It's the very first thing you have to do for a kid presenting with headaches. In actual practice, I see kids all the time with headaches because of the heavy book bags and the desks that they're sitting at all day and the lack of proper movement, the high stress trying to get good grades. So oftentimes kids are coming in for things like headaches without them being scary and pathological. Another option for headaches is something that we also do in the office is deep tissue laser therapy. And with deep tissue laser therapy, it uses certain wavelengths of light to stimulate your cells to make more cellular energy. And when our cells have more energy, they are hardwired to repair themselves if they're damaged. It's their first priority. And then they're given that extra energy. So if they don't need to repair themselves, then they can just do their jobs better and faster. So we tell our patients this is like speed healing. So it's effective, it's non-invasive, it treats pain, reduces inflammation. All the patient feels is a nice, relaxing, soothing warmth. The treatments last anywhere between 5 and 10 minutes. And we use the Light Force brand laser, which is the one that all of our professional athletic teams in the U.S. use. So the NFL teams all have a Light Force laser, Major League Baseball, soccer, basketball, etc. So the machines they use to take care of their multi-million-dollar patient players, we use to take care of our patients. Now, a few kind of obligatory disclaimers. None of the information or options discussed in this presentation are intended to replace medical advice. If you are suffering from headaches, you are encouraged to work with a qualified healthcare professional who is well versed in the areas of headaches and holistic health, nutrition, supplementation, hormone balancing, allergies, etc. If supplements are mentioned or treatments are mentioned, it might not be appropriate for individual people. Again, that's why you work with a qualified healthcare professional, and it's not recommended that a person attempt to do or take everything mentioned in the presentation, again, especially without working with a qualified healthcare professional. So stop suffering. That wraps up our day's presentation. I hope you found the information useful and decide to take advantage of our special offer. This is Dr. Kelley Mulhern from Thrive Wellness Center, where we believe your body is designed to thrive.